Hello friends, this is MBBS Gallery. Today our topic is about azygos vein. This is azygos vein. Azygos, which means unpaired. So how this vein is formed? This vein is actually formed by three most important vein which arises in the posterior abdominal segments. So they are right subcostal vein, here is the one, and lumbar azygos veins here, and right ascending lumbar vein. These three veins contribute to the formation of azygos vein, so that it runs upwards and enters the thoracic cavity through the aortic opening of the diaphragms, and then it connects with the it drains into superior vena cava, so that we call it as a connecting link between superior vena cava and the inferior vena cava, and it has a lot of tributaries. We can see that in details in following. And then most important clinical significance. So azygos veins. As we already know that the term azygos means unpaired. The azygos vein drains the thorax and upper lumbar region. It forms an important channel connecting superior vena cava and inferior vena cava. The vein occupies the upper part of the posterior abdominal wall and posterior mediastinum. It also connects the portal venous systems, caval venous systems, and vertebral venous systems. Here is an important point. It connects several important venous systems. They are portal venous systems, caval venous systems, and vertebral venous systems. And this is a vein, so that it has the formations. How this actually forms? This also we already know. There are three important veins which contribute to the formation of this vein formation. So they are lumbar azygos vein, right subcostal vein, ascending lumbar vein. The lumbar azygos vein, which is an abdominal part right of lumbar vertebrae, lower end communicates with inferior vena cava and right subcostal veins, which accompanies the corresponding arteries. Ascending lumbar veins formed by vertical anastomosis that connects the lumbar veins. So this is formations, and about course, how they are followed. The azygos vein enters the thorax by passing through the aortic opening of the diaphragms. Yes, it is most important point. Aortic opening of the diaphragms. It may ask in one more questions. What are all the structure that are entering, passing through the aortic opening of the diaphragms? If they ask means, so if azygos vein is also one of the structures passes through this opening. It then extends up to fourth thoracic vertebra, where it arches forwards. In lungs, we have an arch that they are mentioning here, where it arches forwards over the root of the right lung and ends by joining posterior aspect of superior vena cava before it pierces pericardiums. So before entering to superior vena cava, the right arches the right lungs, and then they pierces the pericardiums. So what are all the relations? This vein has relations anteriorly. Let us imagine. Anteriorly it has related to esophagus, posteriorly it related to lower right thoracic vertebra and right posterior intercostal arteries. To the right lungs and pleura, great splenic nerve. This is not a saphenous nerve, this is a splenic nerve. So to the left is a thoracic duct and aorta at the lower part, esophagus, trachea, and the vagus nerve. To the left, these are all the structures. Actually, these structures are related to left lung structures. So you have to remember. And tributaries. Like arteries have branches, veins have tributaries. So tributaries are right superior intercostal vein, which drains the intercostal areas, and 5th to 11th right posterior intercostal veins, and hemiazygos vein. Accessory hemiazygos veins, right bronchial vein, several esophageal, mediastinal, pericardial veins. These are all the tributaries which drains into the major vein called azygos veins. Clinical significance. Clinical significance here, congenital defect. It is a rarely condition. The hepatic portion of the inferior vena cava does not form during embryonic development, and as a result, inferior vena cava can continue as azygos vein. So this is refers to as azygos continuation of inferior vena cava. Let us stress here. It is refers to as azygos continuation of inferior vena cava. Thank you.